Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. This episode is brought to you by Pegasus Homeopathics. Pegasus is a trusted household name and provides safe and effective homeopathic remedies to treat everyday ailments. Pegasus is easy to use and 100% safe for pregnancy and babies. Visit pegasuskids.com for more information. Hi everyone, thank you so much for listening or watching again. I have a wonderful episode again with Jacqui Niehaus, and for the attentive listener or watcher, you will remember that she has been with me before, and this time she is back with a power-packed interview on hormonal health for women. She will unpack our hormonal health and what a healthy cycle looks like, which really is the cornerstone of women's health and well-being. She explains what are the current stressors that disrupt our hormonal health and how we can restore it. Jacqui is a biostatistician turned women's health wellness coach. Her goal is to empower women to understand more about their hormonal cycles and how they can use nutrient-dense whole food as a way to nourish their bodies and bring balance back to their health. I trust that you will really feel empowered and inspired by this interview. Please share it far and wide with any woman you know that needs to hear this. Thank you for tuning in and enjoy this episode. Hi, Jacqui. I'm so happy that you agreed to do a second session with me. Our first one was really so insightful, where we spoke about nutrition for moms, for women, and obviously also for dads. We did touch a little bit on hormonal health because it's also interlinked, but I know hormonal health is such a massive topic and so important for our whole well-being, and it is we all need to be way more aware of our hormones and learn to flow with them and keep them healthy and so forth. So thank you for agreeing again to talk to us about that.
Thanks for having me, Margreet.
Yeah, awesome. So let's just first start talking a little bit about, we will talk about women because I think women's hormones are just beautifully and integral. It's delicate. That's the word I'm looking for. We cyclic beings. They change right through the month, and you work with lots of women on trying to get those beautiful cycles back on track and flow. I thought let's call it like flowing through the month with our hormones. So, what is your experience with working with women and just talk general hormones with us a bit.
Yeah, so during our menstrual cycle, like you said, we've got different hormones levels at different times of the month. And I think the major disadvantage is that many women aren't in tune with that. So we might have learned in high school biology about these hormones and then we forgot about it. And I think there's so much benefit to be gained when we take an insight into our cycle and start living a bit more in tune with those hormones. There's a lot of benefit from understanding that part about your body. And there's so much you can do from a health perspective to really optimize your hormone health. So I always tell ladies that their cycle is like a monthly report card of their health. So it's quite lucky to be a lady in that regard, because we get this monthly report card that can give us insights into if our body is maybe under stress, if our body is not getting the resources it needs. And that can be a cue for us to start supporting our hormones better. So
I love that.
Did it pause there?
No, sorry, it's probably just an internet glitch. I was just saying, I love that. A monthly report card. That's great.
Yeah, so if you look at our hormone flow throughout the month, our follicular phase, so that's the phase between the start of menstruation and ovulation, that's a time of higher estrogen. Whereas your luteal phase between ovulation and the end of your cycle is a phase of high estrogen and high progesterone. But in our luteal phase, your progesterone should be higher than your estrogen levels. And unfortunately, in today's modern world, for many women, that's not the case. So they have too high estrogen relative to progesterone. So that can be an issue of excess estrogen and or low levels of progesterone. And when that balance is off, that can result in a lot of the symptoms that women are experiencing today around their cycles, a lot of the discomfort that women are experiencing. So that's why it's so great to track your health, to track your cycle and get an insight into that balance, so that we can start supporting our bodies better to encourage that hormone balance.
Wow, that's amazing. Yeah, it's so important indeed to have the right hormones flowing at the right time through our body to function properly. So what is currently putting our hormones, threatening our hormones? If you think of even growing teenagers, what is that threatening that beautiful balance?
Yeah, so I think something I'm always so surprised by is that nutrition isn't often considered part of sort of the treatment when it comes to hormone health issues. A lot of women who are experiencing these negative symptoms around their cycle either just think, oh, that's being a woman, I'm doomed to these symptoms, or maybe they go on synthetic hormones to try and regulate that. But our lifestyle can play such an important role in that hormone balance. So, for example, if you look at our nutrition, there's potentially vitamin and mineral deficiencies that are at play. So, for example, if you're deficient in vitamin A, in magnesium, or in copper, your body starts to decrease production of progesterone. So vitamin and mineral deficiencies is something that we could look into. Blood sugar control is something to look into, because when blood sugar is dysregulated, that's a major stressor on the body that increases stress hormones, and that can decrease production of progesterone. Stress, I think stress is a major one. So chronic stress, whether it be sort of emotional stress, or it could be things like over-exercising or under-eating, that can quickly throw off your estrogen to progesterone balance. Something I think is quite prevalent in our modern world is overexposure to environmental endocrine disruptors. So these are known as xenoestrogens, and they're found in things like plastic bottles, in detergents, in a lot of the cosmetics that women use, a lot of perfumes, even things like pesticides that we're exposed to in the environment, that can be a contributor to having excess estrogen levels. And then I think something that I also see quite often is just an issue in liver detoxification. So our liver health needs to be really, really good so that it can detoxify excess estrogen. And the liver requires adequate protein and adequate B vitamins to perform its detoxification roles. So that's also something that I think a lot of women maybe are lacking in, not getting adequate protein, not getting adequate B vitamins, and that can be a contributing factor. So all of this to say, I think there's so many things we can do just from a lifestyle perspective to optimize our hormone health without having to go to synthetic hormones to try and balance that.
So that is very empowering to hear, I think, for many people, because it can be very, frustrating. I think if you are experiencing some symptoms, your hormones aren't in check, and then go to your doctor and have to go on a pill to regulate that. So what is your take on that?
Yeah, so I think, like we said, oftentimes now women are experiencing too much estrogen relative to progesterone in their luteal phase. And that can cause symptoms like PMS, like very heavy bleeding or too light bleeding. It can result in irregular menstrual cycles. It can result in severe cramping. So all of those sort of uncomfortable symptoms around your cycle, as well as anovulatory cycles, or even just a missing menstrual cycle, amenorrhea. Those are all symptoms that that hormone balance is off. And when we go to synthetic hormones or hormonal birth control to sort of, let's say, inverted commas, fix that problem, unfortunately, we haven't truly fixed the problem. We've just put a Band-Aid on it. So now we get the appearance that our hormones are better. We're getting this regular cycle, which it's important to realize that the period you get on hormonal birth control is just a withdrawal bleed. It's not your true period. It doesn't follow ovulation. So now we get this seemingly good picture of good hormone health, but we've just put a Band-Aid on it. We haven't actually addressed the root cause. We haven't addressed those lifestyle factors. And the problem with that is at some point when you want to come off that hormonal birth control, maybe to fall pregnant or whatever, all those symptoms often end up flooding back. So now you come off birth control and now all of a sudden you have acne, you have PMS, you just feel like your life is out of control because those root cause symptoms were never addressed.
I'm sure there's many people that can identify with that. Yeah, sure. So what do you advise young women? Let's start with the youngsters, because I do feel like we need to protect them a little bit. Because oftentimes they just want to live. They don't really think too much necessarily about lifestyle related adaptations you can make, but they are really suffering because the hormones have been attacked by our environment and whatever they've been exposed to. So some words of advice for, let's start first, not the pregnant ones, even the youngsters.
Yeah, so I think there should be a bigger emphasis on young adolescent girls actually learning about their hormones. So like I said, often you might have this one biology class where you learn about estrogen and progesterone, maybe if that. But many women don't really understand that and what that means. And so I really encourage ladies to track their cycle. So I like to track the cycle using your body temperature. So your basal body temperature is your waking temperature. And that can tell you so much about your hormones, because after we ovulate and we're producing more progesterone, our basal metabolic rate picks up and our body is much warmer. So we should be able to clearly identify those different phases of our cycle when we track it using the temperature. And I'm always so disappointed that this method isn't taught to adolescent girls, because it's actually very simple and it's easy to implement, but it's not really taught to young girls. And most women only learn about this maybe when they're trying to conceive. They'll start learning about how to track ovulation. But I think as a young girl to be able to track that can be so insightful and teach you so much about your health, because then you can realize, in different phases of the cycle, when different hormones are sort of running the show, your outlook on life could be completely different, and then you don't feel victim to PMS or changes in mood. You just realize that, okay, this is how my body responds when my hormone levels are different. And once we have that tool, that insight to be able to track our cycle, we can start to say, okay, maybe my cycle is a little bit short or a little bit long, or all these things. What is my body telling me? What does it need more of? How can I give it more love, more support, more care? And so I think that's a sort of a missing element in how we approach puberty for young girls.
Yeah, so I think we can do a nice collab on that, targeting the teenagers. They've recently really become, very much. I'm going to work with pregnant women, but really a thing of concern. Even as healthcare professionals, we work in a reproductive health, so that is part of who we are. So we do a lot of family planning consultations, and if you go the age that some of these girls go onto family planning, it's shocking, it is something it's really not setting them up for a healthy life at all, and we're doing it to them, and it's we should be a bit smarter in our health approach and education, and also then empowering them on even knowing when they are fertile and when not. I mean, obviously, forever we scare that teenagers fall pregnant and just let them get a hormone, whatever, in the body. But that is such a low denominator of life, I think, a low way of thinking. We should empower them to be smart and own their bodies and know their cycles and flow with them through the month. As you say, it's actually so empowering to know, like, hey, I'm in my ovulation stage and I feel on top of the world and I want to tackle on everything. Or then you go pre-menstrual and you want to actually just be more hibernating at home. And it's actually so beautiful from being a woman and to flow with your cycle and to learn that and not be at war with your body. So much education needed there. I love it that you say the temperature thing. I must confess that's something I've never done. I'm aware of it in my body. I can feel it and I know my cycle quite well, but that's probably very graphic, just very insightful to see. Do you track it yourself or how do you practically do that?
Yeah, so I love taking my temperature. I think your basal body temperature can give you a lot of insight into your health. So I like to track it and put it on a graph, and I get all my clients to do that as well because we can start getting insight from that. So, for example, I'd say one of the most common symptoms of hormonal dysregulation I see in women is low progesterone. And when you track your cycle, you can see that because the luteal phase is often a bit too short when there's low progesterone, or the temperatures don't rise as much as they should, or there's a lot of spotting before the cycle starts. And those are all signs of low progesterone. So then we know, okay, how can we support the body to start producing more progesterone? Maybe we do need to look at getting more magnesium, copper, vitamin A. Maybe we need to look at lowering stress. Maybe you need to look at reducing exercise load a little bit in the luteal phase. So there's so much insight in that temperature tracking. And I think it's a nice way to really connect with your body. And there's so many tools available now for women to use. So there's a lot of apps where women can put their temperature in. If you're more of a sort of journaling, written person, there's a lot of BBT charts that you can print out to do it yourself. And it might seem onerous, it might seem tedious to do, but I think once you get into the habit, I mean, it's 2 minutes out of your day to quickly do that. And like you mentioned, we're not teaching this to young girls because I think like you said, there's this assumption, oh my word, they're going to get pregnant. But when you start tracking your basal body temperature, you can very clearly identify your fertile window. And that's my preferred form of birth control, is to track your cycle, identify your fertile window, and know that that's the time that you could get pregnant. Other times of the month, you can't get pregnant. So that's why I think it's such a powerful habit to invest in.
Yeah, absolutely. Great. What are some of the apps that you can recommend for listeners? Because this is for every woman, actually very, very applicable. Also for your own natural family planning, if you are, wanting to have a family.
Yeah, one of my favorite apps is Kindara. So Kindara. That's a really nice app. I do want to put a disclaimer that the most of the apps will almost try to predict your ovulation. And I encourage not to listen to the app, but rather track your own indications of ovulation. Because if we rely on the app's prediction, that's just based on their own algorithms. Cannot possibly be very unique to your own body. So I do encourage ladies to track their own symptoms of ovulation. So those are things like your thermal shifts, your cervical fluid. There's different signs that you track. And but using an app is a nice way just to get that visual of your chart.
Kindara. Okay, great.
Yeah.
Yeah. So good side note to take the full package. Maybe not the cheap, the for free one. It's probably more when you pay something that you get at your own symptoms and your temperature.
Yeah, the free version of Kindara is great. I think it's perfect for most women. But if you want that additional feature to be able to track specific symptoms, then you can get the paid version.
Yeah, great, awesome. So from this talk, the main thing that I think we people need to be aware of is how important the production of hormones is linked to our nutrition, and we've done a previous talk on that. So if you haven't listened to that, please go listen to that talk again, because that's the baseline of hormonal health is our nutritional status. So important to know that we need all that it's all interlinked. Our body is one big unit; everything is interlinked. So if we nourish ourselves well, our hormones will also be healthy. And from there, we can also take that imbalance of hormones are really the root cause of so many issues in our body. We have a few more minutes. Would you like to just talk a little bit on that, on the repercussions of hormonal imbalance? We've touched on it already a bit, but just in summary.
Yeah, so I mean, starting from just sort of some symptoms that can be very disruptive to women's day to day. So things like very heavy cycles, I think that can be very disruptive in terms of women's quality of life. Very painful cycles. You know, some women can't leave their house in the first 2-3 days of their cycle because they're in so much pain. And while we do expect maybe some discomfort during your menstrual cycle, if it's to that point where there's so much pain, we need to look at the underlying hormone imbalances there and address that. Other things could be, you know, an irregular cycle that could be a sign of low progesterone. Or a missing menstrual cycle. So more and more, I'm seeing ladies with amenorrhea. So they actually have no period, no menstrual cycle, no ovulation. And that's a clear sign that the body is under so much stress. Like I said, your cycle is a monthly report card of your health. And ultimately, women's hormones are really designed for reproduction. So your body is not going to feel in a safe space to reproduce if it's under stress. So that's a good indication that there's a lot of stress present. And then, some other ways that a hormonal imbalance can affect you could be more on a psychological level, you know, things like anxiety and depression that can be linked to hormone imbalances. And then some more sort of severe repercussions are things like PCOS, endometriosis, and fibroids. You know, those are sort of more physical, severe symptoms that could be a result of hormone imbalances. And I think it's so far reaching on all aspects of our health because our hormones are systemic. So, you know, they affect our brain, they affect so many aspects of our well-being. So I think there's a lot of symptoms that can be traced back to hormone imbalance.
Yeah, absolutely. Absolutely. I think we all have to some degree experienced it. And that's why we've gone on to this track of discovering, hey, what's going on? I've had my personal journey. I'm sure you also had. So just an encouragement for whoever is listening that if you find like, yeah, that's me, there is a way out, and it might not even be as complicated as you think. But by just really doable lifestyle changes, nourishment, healing the body, and then you can go. Our bodies are amazing, incredibly designed to heal itself if we create that right environment. And obviously, that might be very overwhelming. Where do you start? And that's why there are people like Jacqui that's happy to journey with you. Right, Jacqui? That's your specialization. You're really passionate about the hormonal balance, working with women on that, right?
Yeah, exactly. I love educating women on their cycles and really empowering them to understand more about their bodies. And like you said, realizing that your lifestyle, nutrition have a major impact, and the solution might not be as complicated as you think. You know, you might not have to go on severe medications and synthetic hormones. You can do a lot from your lifestyle and from nutrition to support your body.
Yeah. Before I tell them where they can find you, just a little note on the word of caution for synthetic hormones. You did say that again, but I want you to just give a punchline on the word of caution for that. It's not just harmless.
Yeah, so I think what's important to note is that the hormones we find in birth control and other synthetic versions are not bioidentical to the hormones that our body naturally produces. So if you look at progesterone, for example, it plays so many protective roles in the body. You find benefits of progesterone on your brain, on your heart, on your bone health, and on so many aspects of our body. Whereas progestins are the synthetic versions in birth control, and they're designed for a very particular purpose. They are designed particularly to prevent pregnancy, and they are now interfering with your body's own natural progesterone levels, and you're not getting all those beautiful benefits that progesterone provides your body. So that's why I think we need to be quite cautious when it comes to synthetic hormones, and really do everything we can to encourage our body's own natural hormone production.
Yeah, I love that. And also sometimes I think we underestimate the effect of any kind of medicine, synthetic medicine, on how our liver need to process that. Mm-hmm. And then all the work goes into processing basically toxins in our body and don't get to the real work. And that can also be a route to other sorts of issues again. Yeah, liver health is so essential. Yeah, so by all means, if you need to take hormones, we won't be the ones. You must always do it in wisdom and in consultation, but be empowered. That's what we want from this talk. I think more than anything else is to be empowered on how amazing your body is. How beautiful it works and how it really should work. And that all filters through. I mean, we talk so much birth stories on this podcast. So with birth, it's the same. It's all a hormonal dance. And pregnancy is a hormonal dance. Birth is a hormonal dance. And it all works. It's created to just completely do the job if we just allow it and facilitate, create the best environment for it. So it's so important for fertility, for overall health to consider our hormones. So thank you, Jacqui. Where can people find you if they want some help?
Yeah, you can go onto my website. It's wellnesswithjacqui.co.za. And I've got some blog posts there. And you can also schedule a free 15-minute consultation on my website to just find out more about what I do and how I can help you. And then you can also find me on Instagram, Wellness with Jacqui.
And I must say, she's not saying that, but she's got very affordable rates to do coaching with her. So absolutely worthwhile investment. Check her out. Thank you, Jacqui. Appreciate you.
Thank you so much.
All the best with everything, and here to Women's Health.
Bye.
Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.